Psoriasis is a chronic skin condition that affects millions of people worldwide. It often presents as red, scaly patches on the skin, but its symptoms can vary widely from person to person. Because of this variability, diagnosing psoriasis requires a careful and systematic approach. In this video, we'll walk you through the step-by-step process that doctors use to diagnose psoriasis, ensuring that each patient receives an accurate assessment and the most effective treatment plan. Let's begin by understanding why a thorough diagnosis is so important. The first step in diagnosing psoriasis is taking a detailed medical history. Doctors ask about the patient's symptoms, when they first appeared, and whether they have changed over time. They also inquire about any family history of psoriasis or other autoimmune diseases, as genetics can play a significant role. Other important questions include recent illnesses, medications, lifestyle factors, and any known triggers that might have caused flare-ups. This comprehensive history helps the doctor understand the context and potential causes of the skin changes. After gathering the patient's history, the doctor performs a thorough physical examination. This involves closely inspecting the skin for characteristic signs of psoriasis, such as red patches covered with silvery scales, thickened skin, and well-defined borders. The doctor may also check the scalp, nails, elbows, knees, and other commonly affected areas. In addition, they look for signs of inflammation or joint pain, which could indicate psoriatic arthritis. This hands-on assessment is crucial for distinguishing psoriasis from other skin conditions. Doctors pay special attention to the appearance and distribution of skin lesions. Psoriasis plaques are typically red or pink with a silvery white scale, and they often appear on the elbows, knees, scalp, and lower back. The borders are usually well-defined, and the plaques may be itchy or sore. By noting these features, doctors can differentiate psoriasis from other skin diseases like eczema or fungal infections. The pattern and location of the lesions provide important diagnostic clues. Nail changes are common in psoriasis and can be a key diagnostic feature. Doctors look for pitting, small dents, discoloration, thickening, and separation of the nail from the nail bed. These changes help distinguish psoriasis from other skin conditions, as nail involvement is less common in diseases like eczema. Careful examination of the nails can provide additional evidence to support a diagnosis of psoriasis, especially in cases where skin findings are subtle. The scalp is a common site for psoriasis, and its involvement can sometimes be mistaken for dandruff or seborrheic dermatitis. Doctors carefully part the hair to examine the scalp for thick, scaly patches and redness. They note whether the scales extend beyond the hairline, which is more typical of psoriasis. Identifying scalp involvement is important for both diagnosis and treatment planning, as it may require specific therapies. Psoriasis can also affect the joints, leading to a condition called psoriatic arthritis. During the diagnostic process, doctors ask about joint pain, stiffness, and swelling, especially in the fingers and toes. They may examine the joints for tenderness, reduced range of motion, and swelling. Early detection of psoriatic arthritis is crucial, as untreated joint inflammation can lead to permanent damage. This step ensures that all aspects of the disease are addressed. Many skin conditions can mimic psoriasis, so doctors must carefully differentiate it from others, like eczema, fungal infections, or lichen planus. They consider the appearance, distribution, and progression of the lesions, as well as any associated symptoms. Sometimes, additional tests are needed to rule out other diagnoses. This careful process helps ensure that patients receive the correct treatment and avoid unnecessary medications. In some cases, the diagnosis of psoriasis is not clear based on history and physical examination alone. When this happens, doctors may order a skin biopsy. This involves removing a small sample of affected skin and sending it to a laboratory for microscopic analysis. The biopsy can confirm the diagnosis by revealing characteristic changes in the skin's structure, such as thickened epidermis and specific inflammatory patterns. This step is especially useful when the presentation is atypical. The skin biopsy is a minor procedure performed in the doctor's office. After cleaning and numbing the area, the doctor uses a small instrument to remove a piece of skin from the affected site. The sample is then placed in a special container and sent to a pathology lab. Patients may feel a slight pinch, but the procedure is generally quick and safe. The results usually take a few days and can provide definitive evidence for or against psoriasis. Under the microscope, psoriasis has distinct features that help pathologists make the diagnosis. These include thickening of the outer skin layer, elongation of the skin's ridges, and clusters of white blood cells in the epidermis. The presence of these changes, along with the clinical picture, confirms the diagnosis of psoriasis. This microscopic analysis is especially important when the skin findings are ambiguous or overlap with other conditions. While there is no specific blood test for psoriasis, doctors may order laboratory tests to rule out other conditions or to check for complications. Blood tests can help identify signs of infection, inflammation, or other autoimmune diseases. In cases where joint symptoms are present, tests for markers of inflammation, such as ESR or CRP, may be performed. These tests provide additional information to support the diagnosis and guide treatment decisions. If psoriatic arthritis is suspected, doctors may recommend imaging studies such as X-rays, ultrasound, or MRI. These tests help assess joint damage, inflammation, and other changes that may not be visible during a physical exam. Imaging is especially important for detecting early joint involvement, which can prevent long-term complications if treated promptly. The results of these studies are combined with clinical findings to make a comprehensive diagnosis. Psoriasis is not a single disease, but has several subtypes, each with unique features. The most common is plaque psoriasis, but others include guttate, inverse, pustular, and erythrodermic psoriasis. Doctors identify the subtype based on the appearance, distribution, and symptoms of the lesions. Recognizing the specific type is important for choosing the most effective treatment and predicting the disease course. Plaque psoriasis is the most common form, accounting for about 90% of cases. It presents as raised, red patches covered with a silvery white scale, typically on the elbows, knees, scalp, and lower back. The plaques are often itchy and may crack or bleed. Recognizing this classic presentation helps doctors make a quick and accurate diagnosis, especially when the distribution matches typical patterns. Guttate psoriasis often appears suddenly, usually after a streptococcal throat infection. It is characterized by small, drop-shaped lesions scattered across the trunk, arms, and legs. This form is more common in children and young adults. The sudden onset and distinctive appearance help doctors differentiate guttate psoriasis from other types and from unrelated skin rashes. Inverse psoriasis affects skin folds, such as the armpits, groin, and under the breasts. The lesions are usually smooth, red, and shiny, without the typical scaling seen in other forms. Because these areas are prone to moisture and friction, the symptoms can be particularly uncomfortable. Doctors recognize inverse psoriasis by its location and appearance, which helps distinguish it from fungal or bacterial infections. Pustular psoriasis is a rare but severe form characterized by white pustules surrounded by red skin. It can occur on specific areas, like the hands and feet, or cover large parts of the body. This type may be accompanied by fever and systemic symptoms, making it a medical emergency in some cases. Prompt recognition and diagnosis are essential for initiating appropriate treatment and preventing complications. Erythrodermic psoriasis is the least common but most severe form. It involves widespread redness and scaling over most of the body, often accompanied by severe itching, pain, and temperature instability. This condition can be life-threatening and requires immediate medical attention. Doctors diagnose erythrodermic psoriasis based on the extent and severity of skin involvement, as well as the patient's overall health status. Once psoriasis is diagnosed, doctors assess the severity of the disease. This involves evaluating the extent of skin involvement, the thickness of the plaques, and the impact on the patient's quality of life. Tools like the Psoriasis Area and Severity Index (PASI) are used to quantify these factors. Assessing severity helps guide treatment choices and monitor response over time. The Psoriasis Area and Severity Index, or PASI, is a standardized tool used to measure the severity and extent of psoriasis. It takes into account the area of skin affected, as well as the redness, thickness, and scaling of the plaques. Doctors score each region of the body and calculate a total PASI score, which helps track disease progression and response to treatment. Psoriasis can have a significant impact on a patient's quality of life, affecting self-esteem, social interactions, and mental health. Doctors often use questionnaires, such as the Dermatology Life Quality Index, DLQI, to assess how the disease affects daily activities and emotional well-being. This information is important for tailoring treatment to the patient's individual needs and ensuring comprehensive care. Identifying and managing triggers is an important part of psoriasis care. Doctors ask about recent infections, stress, injuries to the skin, medications, and lifestyle factors that may provoke flare-ups. By recognizing these triggers, patients can take steps to avoid them and reduce the frequency and severity of their symptoms. This proactive approach is essential for long-term disease management. Psoriasis often runs in families, and genetic factors play a significant role in its development. Doctors ask about any relatives with psoriasis or related autoimmune diseases. Understanding the family history helps assess the risk and may influence the choice of treatment, especially in children or those with a strong genetic predisposition. Certain medications can trigger or worsen psoriasis. Doctors review the patient's current and past medications, including beta blockers, lithium, antimalarials, and others. Identifying drug-induced psoriasis is important, as stopping the offending medication can lead to improvement. This step ensures that all potential contributing factors are considered in the diagnosis. Psoriasis is associated with several comorbidities, including cardiovascular disease, diabetes, and depression. Doctors screen for these conditions during the diagnostic process, as they can influence treatment choices and overall health outcomes. Comprehensive care involves addressing both the skin disease and any related health issues. Educating patients about psoriasis is a key part of the diagnostic process. Doctors explain the nature of the disease, its chronic course, and the importance of adherence to treatment. They also discuss lifestyle modifications and strategies for managing triggers. Empowering patients with knowledge helps improve outcomes and fosters a collaborative approach to care. In complex cases, doctors may refer patients to dermatologists or rheumatologists for further evaluation. Specialists have additional expertise in diagnosing and managing psoriasis, especially when the disease is severe or involves the joints. Collaboration between primary care and specialists ensures that patients receive the most comprehensive and effective care possible. Psoriasis is a chronic condition that can change over time. Doctors schedule regular follow-up visits to monitor the disease, assess treatment response, and adjust the management plan as needed. Ongoing monitoring helps detect new symptoms, manage side effects, and ensure that patients maintain the best possible quality of life. Accurate documentation is essential throughout the diagnostic process. Doctors record detailed descriptions of skin lesions, nail changes, joint symptoms, and any laboratory or imaging results. This information forms the basis for ongoing care and helps track the disease over time. Thorough documentation also facilitates communication between healthcare providers. Involving patients in the diagnostic process is crucial. Doctors encourage patients to share their experiences, concerns, and treatment preferences. This collaborative approach ensures that care is tailored to the individual's needs and increases the likelihood of successful outcomes. Open communication builds trust and empowers patients to take an active role in managing their health. Cultural beliefs and social factors can influence how patients perceive and manage psoriasis. Doctors take these factors into account during diagnosis, ensuring that care is respectful and culturally sensitive. Understanding the patient's background helps address barriers to treatment and supports better health outcomes. Diagnosing psoriasis in children can be challenging, as symptoms may differ from adults and overlap with other childhood skin conditions. Doctors pay close attention to family history, lesion appearance, and any associated symptoms. Early diagnosis is important for preventing complications and supporting healthy development. Psoriasis can also affect older adults who may have additional health concerns and comorbidities. Doctors consider age-related factors, such as skin fragility and medication interactions, when diagnosing and managing psoriasis in elderly patients. Tailoring care to this population helps minimize risks and improve quality of life. Eczema, or atopic dermatitis, is a common condition that can resemble psoriasis. Doctors distinguish between the two by examining the appearance, distribution, and symptoms of the lesions. Eczema often affects the flexural areas and is more likely to be associated with itching and a history of allergies. Accurate differentiation ensures appropriate treatment. Fungal infections, such as ringworm, can mimic psoriasis, especially when lesions are ring-shaped and scaly. Doctors use clinical examination and, if needed, skin scrapings for microscopic analysis or fungal cultures to confirm the diagnosis. Differentiating between psoriasis and fungal infections is important, as treatments are very different. Lichen planus is another skin condition that can be confused with psoriasis. It presents as flat-topped, purple, itchy bumps, often on the wrists and ankles. Doctors differentiate it from psoriasis by its color, shape, and the presence of fine white lines on the surface of the lesions. Sometimes, a biopsy is needed for confirmation. With advances in technology, telemedicine is increasingly used for diagnosing skin conditions like psoriasis. Patients can send photos or have video consultations with dermatologists, making it easier to access expert care. While in-person exams are still important for complex cases, telemedicine offers a convenient option for initial assessments and follow-ups. Diagnosing and managing psoriasis often requires a multidisciplinary team, including dermatologists, rheumatologists, primary care physicians, and mental health professionals. This team-based approach ensures that all aspects of the disease are addressed, from skin and joint symptoms to emotional well-being. Collaboration leads to better outcomes and a higher quality of care. Support groups and educational resources can help patients cope with the challenges of living with psoriasis. Doctors provide information about local and online support networks, advocacy organizations, and educational materials. Connecting with others who have similar experiences can reduce isolation and improve coping skills. Early diagnosis of psoriasis is essential for preventing complications and improving long-term outcomes. Prompt recognition allows for timely treatment, reduces the risk of joint damage, and helps maintain a good quality of life. Doctors emphasize the importance of seeking medical attention for persistent skin changes. Diagnosing psoriasis can be challenging due to its varied presentations and overlap with other skin conditions. A thorough and systematic approach, including history, examination, and appropriate tests, is essential for accuracy. Doctors remain vigilant for atypical cases and are prepared to use additional diagnostic tools when needed. To summarize, diagnosing psoriasis involves a step-by-step process, taking a detailed history, performing a thorough physical exam, considering differential diagnoses, and using laboratory or imaging studies when necessary. Identifying the subtype, assessing severity, and considering comorbidities are all part of a comprehensive evaluation. This approach ensures that patients receive the most accurate diagnosis and effective care. Research is ongoing to develop new diagnostic tools for psoriasis, including advanced imaging techniques and genetic testing. These innovations may improve accuracy and allow for earlier detection in the future. Staying informed about advances in diagnosis helps doctors provide the best possible care for their patients. Diagnosing psoriasis is a careful, step-by-step process that combines clinical expertise, patient involvement, and the use of appropriate diagnostic tools. By following these steps, doctors can ensure that each patient receives an accurate diagnosis and a personalized treatment plan. If you or someone you know is experiencing persistent skin changes, seeking medical advice is the first step toward effective management and improved quality of life.